Chances are you've been here. Nearly 3/4 of all medical diagnoses start with a lab test. Many tests are covered. Results go directly to your doctor. So whether a lab is public or private for profit isn't something patients would even notice, except when things go terribly wrong.
They didn't tell me I might have cancer. They told me I did have cancer.
Doctors left waiting for test results.
It was stressful because it actually backed up hospital beds.
I feel that the issue of lab services has become targeted as a political football.
No province or territory does lab testing perfectly, but Alberta in particular has been flipping community labs, equipment, and workers between public and private hands for decades. Alberta's Auditor General is now investigating how and why lab services went from being publicly run to privately owned and then switched back to the public sector all within about a year. Some policy experts say they know why.
The driving force behind so much of these changes has to come down to political ideology.
Rebecca Graff-McRae has done extensive research on Alberta's medical lab services.
There's always a lot of carefully worded verbiage in any government policy change that talks about quality of service and improving access. When these changes are taking place, particularly over the last few years here, we've seen the evidence that that's not the case.
Many health policy experts agree contracting out services to private for-profit companies can work if they're still publicly funded, integrated with other healthcare services, offer equal or better outcomes for patients, and they have to cost less than the public system. But in 2016, the Health Quality Council of Alberta compared a well-established private lab services company in Edmonton against a public-private partnership owned by the province operating in Calgary. The report found Calgary Lab Services was 5 to 10% less costly per test and faster at adopting new technology and tests. Then politicians started weighing in. In 2017, the NDP announced plans to build a $595 million super or hub lab in Edmonton, saying it would process test results and set up Albertans for the future. 2 years later, the United Conservative Party came to power. Despite millions spent, the hub lab was bulldozed back into an empty field. A 25-year deal was later inked, privatizing Calgary Lab Services by the end of 2022. By August of this year, 8 months into the deal, there were so many problems, the UCP, under Danielle Smith, announced lab services would return to a publicly run service by the end of this year.
The wait times for appointments with the private labs was about double.
Cam Clark is living those changes. He's recovering from cancer and requires ongoing testing.
They're critical. Without the lab tests, they cannot do the treatments. They cannot provide them. It would not be safe to do so.
The ground kind of drops out from under you.
Lita Bablitz went in for a routine mammogram in 2021. Ultimately, results from a private lab said she had breast cancer. She underwent a partial mastectomy. Weeks after her surgery, public lab testing revealed she never had cancer.
I'd already lost a massive chunk of my right breast, and I have permanent damage to my breast. For them, that's the end of the story.
Mistakes can happen in public labs too, but there's greater accountability. Bablitz says there's a wall of secrecy around private labs. Despite numerous attempts to get information about her tests, she didn't get any answers. The company was protected by a private contract with the government, which patients aren't even allowed to read.
All these government bodies that you thought were there to oversee don't have jurisdiction over Dynalife.
I think that we need to take the ideology out of how health care is delivered. We don't understand what
Joel Lexgen is a retired ER doc who taught health policy at York University. He says what's happening in Alberta offers lessons for other provinces and territories.
The fundamental philosophy of the way the system runs should be based on evidence.
Alberta's premier has said the system will remain public for now. Edmonton Dr. Lenora Saxinger says that's concerning.
The idea that it might change yet again is really kind of daunting to imagine because it's just been so chaotic.
She says what patients and lab workers need now is stability, transparency, and quality care.